Hi, my name is Josh Brody. I run the lymphoma immunotherapy program here at the Icahn School of Medicine at Mount Sinai and Tisch Cancer Institute. This year at ASCO, although it was virtual and in that way, some ways easier to get to, there was a huge amount of information. And in our particular focus area, lymphoma and CLL, there were extremely exciting abstracts. Some of these things we've known about for a year or two, but just the amount of progress that's been made and progress that will have very near-term benefit to our patients. And for some of our patients, even today, progress was amazing. And if I had to give an overarching theme, it would be that there were a couple of types of what we call T-cell redirecting therapies. These are therapies which get our own immune systems to go after lymphoma and melt them away. And the two examples of this that have been big themes at this year's ASCO presentations have been something called Allogeneic CAR T cells, of which there are several types. Allogeneic CAR T cells are a newer version of something that's already become a standard therapy called autologous CAR T cells. The difference being autologous CAR T cells, patients give some of their own immune cells. We actually change some of the genes in those immune cells, put them and reinfuse them back into the patient, and they go and hunt down lymphoma cells and eliminate them. The concept here is instead of using a patient's own immune cells, which can sometimes be a bit difficult, but also cause real delays in therapy because it takes time for each patient to make an individualized autologous CAR T cell product. Now, instead, we can use an allogeneic CAR T cell. We call it an off-the-shelf type therapy, such that the CAR T cell is ready to go whenever a patient needs it. And there are a few different versions of these allogeneic CAR T cells as immunotherapies being brought to our patients. But these trials are very small so far, just so far publishing 9 to 10 to 20 patients in these trials throughout the world. So just a little bit of a hint that these things can be effective. Perhaps an even further advanced approach now is another type of immune therapy called bispecific antibodies. And these are the same idea in that they are an off-the-shelf product. You don't have to make them in a personalized way for each patient, but we just infuse these, what we call bispecific antibodies, into each patient, and they grab a lymphoma cell and then they grab an immune cell, bring them together and make the immune cell get rid of the lymphoma cell. And these have been around for a couple of years, but the progress now is unbelievable. There are at least 3 versions of these, which were well described at the ASCO meeting. One called glofitamab, one called epcoritamab, another called mosunetuzumab. And the punchline is that even for patients with aggressive lymphomas, one type is called diffuse large B-cell lymphoma, these bispecific antibodies were inducing remissions in many cases more than 2/3 of patients. And many of these, the majority were actually complete remissions, lymphoma melting completely away on follow-up imaging scans. So we don't know if those remissions will last forever. So far, it's very promising. But this is going to absolutely revolutionize the way that we take care of patients with lymphoma. None of these bispecific antibodies are standard therapies yet, but they will be in the next 1 or 2 years. And most of these are available as parts of clinical studies that are ongoing right now, including here at Mount Sinai.